one of the headlines for COVID in the country is Moderna asking Health Canada to look at the research and to authorize a booster of its vaccine. And the reason is because it has numbers and information that points to a waning immunity. This is something that we're talking about a lot. There are new studies that Pfizer has just released that indicate as well a drop in its effectiveness after a couple of months. What is the latest thinking on waning immunity of vaccination, Dr. Oughton?
As you and your viewers are probably aware, NACI fairly recently recommended boosters in limited circumstances, particularly people who were in sort of long-term care facilities, people who are immunocompromised, which, of course, those were largely the groups that most Canadian provinces prioritized in terms of early vaccination. So it's certainly not a broad spread or a widespread approval for boosters to all comers, as we have seen happen in some other countries right now. And there's several reasons behind that. One of the principal reasons in my mind is that it appears that probably by what Canada did, having to sort of triage the vaccine supply and as a result space out the intervals, that probably that's standing to our benefit now in terms of giving us longer lasting protection, at least when it comes to severe disease. And therefore, we probably don't need to do widespread boosters yet. Could that come if there was either enough time elapsed, or if there was some other variant that came around that was able to escape the immune response better than the variants we've previously seen? That's certainly possible, and I think that's something that researchers are watching very, very closely for.
I think, yes, your key word is yet, because I had a conversation yesterday, Dr. Oughton, with the top doctor up in the Northwest Territories, which has a very, very high vaccination rate, but is seeing quite a strong number, in fact, record number of cases, and many of them are breakthrough cases. And what she explained to me was NWT has vaccinated extensively and very, very early. So it's also seeing the early effects of waning immunity on its people and on its patients. So it's looking at starting boosters on a more widespread basis. And maybe this is something that we are going to see increasingly.
That's certainly a possibility, and I think we need to be watching very closely for that. One thing I'm not aware of is what dosing interval was used in those very early days in Northwest Territories, because that certainly seems to be part of what's going on here. Is, for example, Israel, that followed the manufacturer's instructions with Pfizer, trying to space those two doses apart by 3 weeks very, very closely. They also recently have run into a lot of waning immunity, but it's if Northwest Territories followed that course, that might be in part why, although again I'd have to see what their actual dosing intervals was to be able to comment further.
The booster that Moderna's asking for is half the size of the dose that would have been originally administered, interestingly. I have a final question for you, and it's from a viewer. This week, Dr. Oughton, Saskatchewan began to take appointments for flu shots. So let's talk about another shot right now. Appointments open in Saskatchewan. They'll be starting to give those shots soon. And Layla was writing about this with this very specific question, how she's double vaxxed for COVID, but should she take her annual flu shot as well? Do you have an answer for Layla and anybody else wondering something similar, Dr. Oughton?
So certainly influenza is something that has been hovering around during the pandemic. However, thankfully, both in Canada as well as in many other countries, we've seen very, very little actual influenza disease so far. That doesn't mean that it can't happen. This is such an unprecedented time with this lack of influenza that's really hard in my mind to accurately predict what's going to happen. So in that uncertainty, I think it makes sense to be prepared. And yes, if you fall under your province's criteria for getting the seasonal flu vaccine, by all means, you completely should. There's no interaction or no contraindication for people who have been vaccinated for COVID to avoid getting the influenza vaccine. They certainly should, and most provinces are coming out with it either now or in the month of November.